Hey everybody, Josh Hannabury here, Truck Focus Podcast. First off, I hope you're having a really good day. Welcome back to another episode of our podcast, where I'm super excited to introduce to you a new expert that I've been getting to know over the last couple of months. His name's Troy Copley. He's a registered respiratory therapist. Really excited for today's episode as we really dive into just different challenges people may face with sleep, the long-term impact of not sleeping enough, and how him and his organization across the province of Alberta really do help people. Honestly, it's life-saving. So stay tuned. Really excited. Thanks so much. Good day. Welcome back to the Truck Focus Podcast. On today's episode, I'm super excited to introduce to you an expert that specializes in a topic I believe is extremely important and something that we probably don't obtain enough of, which is sleep and the health risks of not getting enough sleep. So I'd like to introduce you to the podcast, Troy Copley. Troy is a registered respiratory therapist in the province of Alberta, who's approaching nearly 20 years of experience in the field of respiratory care. Although he has worked in many areas of this diverse field, including diagnostics, critical care, and therapeutic management, he has taken a keen interest in sleep medicine. So his passions developed into 8 locations throughout the province of Alberta that has become an integral leader in diagnosis and management of sleep disorder breathing. So welcome, Troy. Thanks so much for being on the podcast today.
Well, thanks for having me, Josh. It's nice to finally sit down and talk about this. We've been talking about getting together for some time now. I feel sleep is, as you said, probably the most important thing now that we can really focus on, because it's been ignored for so long. And as far as respiratory goes, I mean, there are many sleep disorders, and sleep apnea has kind of taken a headline approach to things, because it's been related to so many problems, and from disease to accidents to effects on your daily life. And that's probably why I found it to be an area of interest for me, working in critical care to diagnostics to therapeutics. This is an area I really feel that we can make a difference and help people feel better and be healthy at the same time. So this is kind of where I found my passion to be in, and that's kind of where I delved in and grew a large network of clinics to help the general person.
It's incredible.
Yeah,
you're right. It's funny, as you're talking, and I'm a note taker, so if you see me taking notes, it's because I like learning as we go. And I'm excited that you're here. We've been talking about this, like you said, for a little bit. And my podcast, the entire platform of the Truck Focus, is to introduce industry experts that I really respect to our industry. So it's nice to know that you have a specialty. Obviously, you have proof in the pudding, because you have successful clinics that are changing the lives of tons of different people, and it doesn't obviously just stick into the truck.
It's not just me. I mean, there's a network of sleep physicians, therapists, nurses, RPSG techs. I mean, it's throughout the province. It's a large network, and we're part of it. But we're not the whole scheme of things, but we're very, very involved and can take patients from start to finish when they come in.
Oh, that's awesome. So thanks so much for being here. So I guess you mentioned a couple of things. And what exactly is like a sleep disorder, if we wanted to start there?
Well, it's a very complicated response, I guess you could say, in terms of definition, because there's lots of sleep disorders. Ultimately, any condition that will affect your sleep could be considered a sleep disorder, but we're talking about nocturnal problems. I believe there's more than 80 sleep disorders diagnosed. And as far as that goes, the most prominent one that we deal with is sleep apnea. We do obviously assist with triage of people with insomnias or parasomnias and other sorts of sleep problems to the appropriate destinations with sleep specialists to get the help they need. But like I say, for us, sleep apnea, because it's a respiratory related disease, because it's breathing related, that's our primary focus, I guess you could say.
And is that something that like the average person could get? Is it something you're born with? You just catch it like a cold, or how does that work?
It's predominantly anatomical, so how you're shaped. I mean, the average person could have it. I mean, if you look at an individual, I mean, we all look the same. We all have the same features, nose, ears. They're all shaped a little differently, of course. If you go inside the airway, we look at the same features. Everybody's got them, but they're shaped a little differently. Those that are predisposed to sleep apnea would have a very, how do you say it, tight airway. So maybe a larger tongue, narrower throat, large pharynx, recessed jaw, you know, those sorts of things. And I might correct myself there, small pharynx or small back of the throat would be what I meant to say. I think I said large, but, you know, a tight airway essentially. So other factors that will precipitate it: weight gain, medications that relax muscle tone, excessive booze use, excessive periods of time without sleep. You know, these sorts of things can obviously exacerbate it, but the predominance is, you know, related to how you're shaped. And when I say, you know, your airway relaxes at night, well, you can't stand up and sleep. So the same thing happens because there's no bone in your tongue and there's no cartilage in the back of your throat to hold that area open, because you move that airway all the time to swallow your food and cough and gag and talk. So it's basically, you know, a big open airway. When it relaxes, yes, it'll close a little bit, but you can still breathe easily. A tight one, when it relaxes, a little harder to get the air past.
So that's a lot of possible, I don't know if victims is the right word, but
Yeah.
people that unfortunately, I'll say unfortunately, obtain this disease. That's pretty, yeah, it's interesting. I'm just trying to think in my day-to-day life how many people I meet that just,
I would say, you know, some estimates, you know, 5% of the population, some estimates 15 to 20% of the population have some level of sleep disordered breathing.
wow.
And, you know, to look at somebody, you know, I am very keen to see somebody that I suspect would have it, because I look for those sorts of traits. But overall, most people often will not know they have it unless they have symptoms. And some people don't have real significant symptoms, but they have sleep disordered breathing. And that's the hard part.
What are some noticeable symptoms that people could have?
Well, obvious ones for the most part would be, you know, excessive tiredness. You know, in some more severe cases, frequency of urination at night can increase, headaches, some cases acid reflux, night sweats, you know, restless sleep, you know, jaw tension or grinding of the teeth can be related. The interesting thing about a lot of these symptoms is they can be non-specific, right? I mean, they could be related to other disease processes. But the only definitive way to actually ensure that it's not related to sleep disordered breathing is to do a sleep study so that we can rule that out. You know, frequency of urination can be related to perhaps, you know, a prostate issue or something of that nature. You know, headaches, maybe it's, you know, environmental, dietary, you know, there's just a host of things. But,
Right.
you know, if you can find some symptoms, and this is what the process the doctors follow, you know, they look at somebody, oh, it may be this, it may be this, well, test this, rule that out, okay, now we'll test this. And sleep disordered breathing is readily tested now, and you know, that's what we do, you know, at Dream Sleep Respiratory, is we test people. And you know, if that's not the issue, it goes back to the doctor, and maybe they look for some other reason that they have high blood pressure, you know. So it's look for something, rule it out, and based on symptoms, and then move on to the next thing. Or, geez, we found it, you know, this is what we need to treat.
Right.
Yeah.
So if someone goes a prolonged period of time, obviously not getting enough sleep, there's lots of dangers we can explore, but just for your overall health, grumpiness, what's the worst case symptoms or worst case scenario for someone that doesn't get it diagnosed?
So related diagnoses that could come from it, is that what you more or less
Yeah.
I mean, they're speculating and studying and finding things all the time, right? But, you know, the most common ones: high blood pressure, diabetes, stroke, heart attack, arrhythmia, GERD or gastroesophageal reflux disease. They're thinking of a lot of cognitive related issues, which is more related to what, you know, your profession is a concern for. They're saying they're not sure it's directly related, but they've seen 2 to 2.5 times more people with Alzheimer's conditions. There's a lot of research that has gone into this, because sleep was largely ignored for so many years, going back 30, 40 years. I mean, we're sleeping, what could possibly be wrong?
Exactly.
Let's focus on the waking hours, what you're doing to yourself.
That's right. Yeah. So you mentioned our industry, so in the transportation industry. First off, when I mention transportation, I like to clear a stigma. So most people think it's a tractor trailer, like we've talked about some of your family's background, and that's a small sector in transportation, because a commercial vehicle is always defined by weight and then what the vehicles itself is doing.
Yeah.
So once we identify that it's a landscaping company, potentially, it could be a telecommunications company with a boom to fix power lines. Like, there's tons of different sectors. That's a lot of people at risk, potentially, that, definitely need to monitor that. But it's also interesting. So again, transportation, there's certain legislation in place to monitor hours of work, that kind of scope. But this conversation, like an actual disease that's preventing adequate sleep, it's not talked about nearly enough. So
it's definitely considered, alcohol is an impairment, cannabis could be an impairment, lack of sleep, it could be considered an impairment. And the worst part is, most of the time, it happens, the lack of sleep from, they may be clocking in 8 hours of sleep time, but is there any quality there to get the restoration they need, right? And never malicious. Often it goes, unknown. Like I said, they just feel that, everybody feels this way, and I'm going to brush myself off and get to work and get my commitments done, or my other commitments done. And whether, it's interesting. People just persevere.
Yes.
And then all of a sudden, things might start to fall to the wayside, and, they start necessitating, lifestyle based on how they feel. And that perpetuates their snowballs at more. I mean, they go home after work and, instead of cooking a healthy meal, they grab a pizza, because that's all the gas they got left in their tank.
Yes.
Or they're missing out on family events, or, it just keeps going and going and going. And, you don't realize all of a sudden you are missing out on life.
Yeah. When you mentioned that, when we first spoke about the healthy meal, like just the trickle effect, that really, I'd say that's like, it hit me in a good way, because I think because I'm still in the office even during all this time.
Yeah.
And so many days when I'm going home, that's exactly where my mind goes, is what's easy, what's fast. And it's just because you're tired. Yeah. So then, when you have obviously kids in the picture, you have other stresses outside of our normal jobs. Yeah, that's a really good point. And then, okay, I'm going to skip the gym because of whatever.
Oh, that's just it. We don't realize all the demands we do have. It's not just, like you say, it's not just employment demands. It's familiarity demands. It's, personal needs, like you say, the gym, health, it influences your choices when you don't have the energy to do so. And this can also change your relationships with people, because guess what? People that don't feel good don't deal well typically. I'm not going to speak for everyone, but this is just how it is. You don't feel good. You're just trying to get through the day.
That's right. Yeah. Or you're the grouchy one at the
and
gathering of whatever it is.
Yeah, maybe you're not really the grouchy guy, but you just don't feel good.
That's right. Yeah.
And unwell people don't usually deal well.
That's right.
So
yeah. Okay, so since we've kind of painted a good picture, I'd say, again, high level, the challenges, the detriments of it. Let's shift the conversation to a more positive light. And is part of it, obviously, I want to dive into what your organization does.
Yeah.
So what, I guess, first steps, we kind of talked about how would someone realize or start paying attention and maybe they could have it. And you mentioned the assessment. So can we go through, like, basically what's the sign-up process for an assessment? What is an assessment? And is there any life-changing small baby step things we can start doing basically today just to start feeling a little better, if we want to go down those routes?
That's a very big question and a very good one. Ultimately, sleep testing is easy. It can start at the general practitioner level is where we need to start. And essentially what they require is just a referral that says it's a sleep study. And we prefer it say level 3, but like I say, sleep study will suffice. And essentially appointment is booked at one of our locations. The patient comes in, has an interview with the respiratory therapist who takes a list of some measurements, vital signs, symptoms, medical history, list of medications, these sorts of things. And all this information is then provided to the respirologist who would interpret it, who's also a sleep specialist. But we would then show them how to use the recorder prior to them leaving. The recorder is nice in the fact that it's a take-home study. So typically people sleep a little better in their own environment. The temperature's just right, the sounds are the same, they've got their favorite pillow, their jammies, everything's just set up, just what's ideal for their sleep routine. And 3 leads would be hooked to the body, measure oxygen, heart rate, airflow, body position, snoring from those 3 leads. They bring the recorder back the next day. The respiratory therapist's assessment is plugged into the data, provided to the specialist, he interprets it. And then we have a result, which is then sent back to their general practitioner. And if there's some concerning information, then we obviously call the patient to go over the results. That's kind of how that part goes, but that's probably, when you talk about feeling better right away, it's an easy process. That's probably the best place to start, because if you're really experiencing some problems, it's mustering that energy just to get the sleep test done.
Right.
Because don't get me wrong, daytime fatigue, if that's the predominance of the issues, and somnolence, it could be something else. There's a lot of problems that can be related or can have a side effect of daytime fatigue. Diseases, medication side effects. We look at blood, your iron, your hemoglobin, your B12, thyroid, blood sugar, these sorts of things, your sleep prep, sleep hygiene. The list goes on and on and on and on. But ultimately, you went to your GP and said, I'm tired all the time and this is what's happening. I snore. My wife says I stop breathing. You're going to say, yeah, do a sleep study. Don't get me wrong, they may do some blood work too, because there could be some other anomalies going on, because I'm going to be honest, us guys don't typically go to the doctor as much as we need to.
That's right. Yes, 3, 4, 5 reminders, then we go.
Women are a little better at that. I hate to say it, but it's true.
Yeah.
But when the doctor has you as a captive audience, do this, do this, do this, do this, right? So, but that's honestly the best place to start, because you gotta fix the underlying problem to start fixing the other issues, really.
Right. Yeah, I was going to kind of be my next question then, is what type of success stories? I know you can't divulge too much with clients, but is that
specifics? But I will tell you this, we have weight loss successes, incredible weight loss successes. We have people coming off high blood pressure medications altogether. We have people that have improved sugars, in terms of, waking blood sugars, people's ejection fractions on their echocardiogram. I hope I'm not getting too deep, but have improved. Obviously, I've had a guy that decided to get a second job. He had so much energy because his wife was getting annoyed he had so much energy.
Never heard that before.
So, anyway, he got a second job, but not everybody does that, so don't worry. But you know what I mean? There's so many things. Some people can't lose weight. You treat their sleep apnea, and guess what? All of a sudden they can start losing weight. And it's not because they weren't exercising, it's because what was going on in their sleep that was fighting their weight loss. And there's some really interesting components in the chemistry world of the body that would definitely influence your outcome.
And is it there's no such thing as a magic pill, but
Yeah.
from my knowledge, it's not like a pill you subscribe, but it's a process in the machine. Can you kind of walk through that?
Yeah, absolutely. There's different treatments depending on what's diagnosed. I talked about a take-home study, but there's a few people that have really bad results that we find on the take-home studies, and then we triage them to an overnight stay at a hospital. And that's a very slim number. But I will tell you this, if it's needed, it's needed. And sometimes the respirologist will say, we need to do a breathing test or a particular blood test, I don't want to get too deep into that, but I can't give you an exact percentage, but most people will not need that level of investigation. So the respirologist will say, this is your diagnosis, whether it's mild, moderate, or severe, and he'll recommend different courses of treatment. The gold standard is still CPAP therapy, but sometimes positional sleep aids, modification of lifestyle, look at some other disease process to maximize those, dental appliance in some mild cases, it all depends, right? And depends on the person. And that's the important thing about when somebody comes in, you got to kind of look at the individual and what, they want to do too, because guess what? The most complicated part of the process is always going to be the human entity, because they have an idea of comfort, tolerance, and what they want to do. And ultimately, they have their own choice in their own care. So, you offer what you think's best based on your respirologist findings, but you may end up modifying that depending on what the patient wants to do.
It's incredible. I didn't realize the scope was so vast, because there's a lot of stuff there.
Yeah.
So with sleep apnea, I'm familiar with that term. So I don't know the exact stats in Canada, but I do know some stuff in states where at one point they were required to have a sleep apnea test prior to obtaining their their class A, their commercial driver's license.
Right.
Part of that, so if they had sleep apnea, they would have to have a machine. They'd have to, obviously, if they're sleeping in a bunk in the truck, carry that machine with them. What, I guess, if you don't mind, what is that machine? What does that machine do? Is it comfortable? Is it a pain in the butt? How does that work?
It's interesting. I mean, we got 5-year-old kids on them, and we got 9-year-old people on them. But it's like anything. I mean, you get very routine as a human being. Everything you do is based on likes, comforts, and what you know. And just like any treatment, you get used to it. And you talk about a CPAP machine, for instance. I mean, ultimately, some people first night are just running with it. Other people, we work with them. When we trial a CPAP on somebody, you meet with them weekly. You talk to them about their comforts, their discomforts, what they like, what they don't like. Look at the numbers, because the machine provides a host of data that we compare to the original study. And then we adjust the settings based on, like I say, comfort and effectiveness. And ultimately, that's how we get, the best outcome, because we're trying to blend the two, right? You got this teeter-totter here, here's comfort and here's effectiveness, and you got to just kind of balance them, and then you get them to where they need to be. But like I say, that's why we trial it, get them to that comfortable point so that, they are treated. And by that time, that's when we start talking about, so has this changed? Do you get up less to pee? Do you still have headaches? Sleep less restless, less jaw tension? These sorts of things are, kind of how we base the outcome, symptoms and numbers. So there's a science behind it.
Incredible. Yeah, I'm just picturing. So again, I'm in the world of professional drivers all day long, and I like watching a transition in someone. I always call it a pivotal moment, where they go from, we'll call them Grumpy Bob to Joyful Bob. And the overall, like the life improvement, the job happiness, the customer satisfaction, the carriers feel safer because someone transitioned from being grumpy to being just a little more happy. And so some of the things that you're just speaking really resonates in those conversations, because like no one, like if I'm a grumpy professional driver, like no disrespect to anyone that's grumpy, your customer service level is not as high as someone that did get a good sleep, but your pre-trip inspections, your piece of equipment safer because you have energy, you're less likely. So one of a common accident's a backing accident. And a lot of times it's because no one got out to look. So we always call it goal. But again, going through the process, identifying, okay, yes, this is actually what I have. Obviously dealing with Troy and the team to make sure that you have the right solutions. Now, again, you're combating collisions, you're lowering your risk rate. So there's a lot of positives there that you mentioned that really piece well in the transportation industry.
Absolutely. I mean, productivity goes up, from a employer standpoint. I mean, geez, people's health improves. So obviously that helps with the benefit plans, which can possibly make your benefit plan more robust to the individual that's, you know, working for that company, because the costs have diminished, right? You know, if you can cut back some accident costs, you know, the staff members aren't 10 minutes late every day because they're tired, or extending their lunch break 30 minutes. And, you know, I'm not saying they do that even if they're tired, but, you know, chances are some people are, you know, going down that slope just because they're not even aware of it, just because they're having a hard time just making it through the day.
That's right.
And, you know, as an employer, I mean, I employ lots of people too. And, you know, if I saw somebody that was tired, I definitely would talk to them and suggest that. Because guess what? A lot of people told me it's the best thing they ever did to give them their life back.
Totally.
Yeah. And it gave them some job security as well, because guess what? They're one of the top employees. They're not going anywhere. You know what I mean? It just, relationships have improved in their workplace and their family. You know, they become very tolerant, and when you're a tolerant person in today's world, I mean, geez, you do quite well. You know,
Totally. Yeah.
Well, yeah.
Well, yeah, especially as a lot of people are faced with isolation. If you're exhausted in isolation versus rested, it's impressive what you can create in your own space when you have the energy to do so.
I hit the nail on the head. I mean, sleep's probably never been more important than during COVID. You know, if you've got, you know, a good recovery process in terms of sleep, guess what? You're going to deal a lot better. But, you know, with all of these calls for increased mental illness and so forth, let's get people well rested so they can better deal with their day. You know, so anyway.
Yeah, no, I agree. So from an employer standpoint, so a transportation company, can they like call you up directly? Or what's the process, so that way, say they wanted to get their drivers tested or something?
Absolutely. I mean, you know, I've dealt with other professional driver companies, and you know, talked to them, and human resources or a manager, you know, and they said they've wanted to proceed with some form of testing. Obviously, their staff has to be on board for that. You can't force anybody to do it, but, you know, encourage it. And yeah, we set it up and get them their prescriptions and so forth, and help them get to a point where they can get tested and treated. And it's been very productive. Absolutely. You know,
yeah. I think those conversations, even for my part, will be more, you taught me a lot so far today. It's awesome. But yeah, just dealing with, so people are always trying to think really outside the box. How do I solve this? And some of it, honestly, well, a lot of it kind of focuses right back to sleep. So the fact that, if it's a human resource manager wants to give you a call, I'm going to start planting that seed too, because, or the clinic the call, because that trickle effect to like driver retention, to customer service, to dispatch like, again, speaking transportation, it goes into a lot of areas. So if carriers are able to help themselves by helping their people, then that's really important.
And look how good it really shines on you as an employer too. I think that will obviously add to employee retention. And I'm not saying any sort of employer would have poor employee retention, but you know what, you helped an individual immensely. Most people would be thankful for that.
Yeah, I agree, especially in today's job market too, where I think authenticity is important, empathy is important, and I always say we've turned away from being a tyrant to a person. And when, you can, as people, realize, like you said, if one of your staff are tired, you're going to ask them, like, hey, are you okay? And I live that basis too, where like I try and watch people's consistencies as the focus as I can, because I like knowing people are happy, they're good. But if there's a problem, what's the problem? Like, how can we help? So that's important.
Yeah, absolutely. And like I say, it really builds a strong relationship with your employees.
Yeah, no, I agree. So kind of just in closing, was there any final thoughts that you'd like to say, any advice that you would like to share? And then also, how can people get in touch with yourself and your clinics?
I mean, you know, I can't stress enough, you know, lots of times people put things like this off. And I must really say, it's probably one of the most important things you could delve into. I mean, what else is related to so many diseases? So, you know, you wait, you know, you figure you got a problem in your 20s or 30s, but you put it off to your 50s or 60s, it really beats up your body over time. And sometimes you can't rid yourself of those diagnoses. It's not like you can fix them often once they're there. And you know what? Who wants to do a 20, 30-year ride without feeling good? So take the time, make the time, even though you're exhausted, because it could likely be the best thing you ever did. And that's the biggest takeaway I could give to, you know, treating people for years. And I really, really have to stress that point. If somebody wants to get a hold of us, unfortunately, I don't remember my 1-800 number off the top of my head.
I'll put it in the show notes. That's okay.
But absolutely. I mean, we have a website that has a referral form on it. It's www.dreamsleep.ca. And it's on, I believe, on the top right hand of the page. You just click on it, print it, tick off sleep study, take it to your doctor and say exactly why you're there. If you're there for a sleep problem, I mean, we do many things, but say you want a sleep study and this is why, no doctor would turn that down. They'll say, yeah, absolutely, sign it, phone us up, say, I got my form, need to get booked in. After that, you take the bull by the horns, deal with it, respond to your doctor, let them know where you're at, and, you know, get you treated. If that's indeed what you want to be. I got to stress this too. You got to be there for the right reasons. You got to be ready to do it. And don't be there because your wife wants you there, or your doctor wants you there. You got to be there because you want to fix it, because it can require a little bit of work, but it can be the easiest thing you ever get to. So
Incredible.
Yeah.
Incredible. So, well, thanks, Troy. Honestly, this was,
no,
I love learning, and I know our audience is learning, and this was awesome.
No, I enjoy it. I enjoy teaching, and you know, obviously consorting with different groups of people so that the message gets out of it. So yeah.
Awesome. Well, yeah, I honestly, I'd like forward to do this more. I think if we dive a little deeper, maybe into areas of sleep apnea, areas that it impacts the transportation industry, maybe bringing on someone else from your team, and we could have whatever that looks like.
Absolutely. I could bring on some props and so forth, so I can give a little bit better descriptions, because you know it's hard to explain sometimes with thin air.
Yeah, I draw a lot.
I know. I'd like to have some props, maybe some pictorials and some models, so that I can better teach.
Awesome.
And it usually has a better outcome.
So no, this was awesome. So thanks so much again. And I'll make sure all of your information is included in the show notes, so that way everyone can be in contact with you as well. So
absolutely. Thank you very much.
Thanks, Troy.
Okay.
Well, that's all for today's episode. Thank you so much, Troy, for coming onto the podcast. I really enjoyed our conversation, and I felt you did a really good job just explaining the worst case scenario, but also the best case scenario when someone has a sleep disorder, as well as just the ease of working with you and people in your clinic to ensure that if you do have a problem as a person, you can actually get some help. So thank you so much for coming on. For all of our dedicated listeners, thank you for all of the support. It honestly means the world to myself, my family, and the entire Truck Focus podcast team. As always, if you're watching this on YouTube, I ask that you subscribe to the YouTube channel by simply pressing the little red button. And if you're listening to this on any other platform, I ask that you like, share, communicate, give feedback, ask questions, because it all makes a huge difference. So thank you so much again. Have a wonderful day.